Adaptive behavior treatment by protocol, administered by technician under the direction of a physician or other qualified healthcare professional, face-to-face with one patient, each 15 minutes. Group adaptive behavior treatment by protocol, administered by technician under the direction of a physician or other qualified healthcare professional, face-to-face with 2 or more patients, each 15 minutes. A trained technician or assistant behavior analyst conducts a face-to-face behavior therapy session to a single patient with destructive behavioral concerns, such as harming oneself, damaging property, and aggression or behaviors resulting from recurring actions or issues related to communication or social interactions. A physician or other qualified healthcare professional, who may or may not be present during the course of the treatment encounter, devises the treatment plan for the technician prior to the patient encounter. Adaptive behavior treatment with protocol modification, administered by physician or other qualified healthcare professional, which may include simultaneous direction of technician, face-to-face with one patient, each 15 minutes. The physician or other qualified healthcare provider conducts a face-to-face behavior therapy session to a single patient with destructive behavioral concerns, such as harming oneself, damaging property, and aggression or behaviors resulting from recurring actions or issues related to communication or social interactions. During the encounter, the provider solves at least one problem with the protocol and may, at the same time, coach a technician or assistant behavior analyst, guardian, and/or caregiver in how to oversee the treatment procedures, modified protocol. The patient must be present during the session, including instructions provided to the technician and/or caregiver. Family adaptive behavior treatment guidance, administered by physician or other qualified healthcare professional, with or without the patient present, face-to-face with guardian, /caregiver, each 15 minutes. Multiple family group adaptive behavior treatment guidance, administered by physician or other qualified healthcare professional, without the patient present, face-to-face with multiple sets of guardians/caregivers, each 15 minutes. The physician or other qualified healthcare provider conducts a face-to-face family behavior therapy session for a single patient's guardian and/or caregiver. The patient may or may not be present. During the encounter, the provider helps the guardian and/or caregiver learn how to identify behavioral problems and how to implement treatment strategies to minimize destructive behavioral concerns. Report 97,157 when the session involves multiple sets of guardians/caregivers without the patients present. Group adaptive behavior treatment with protocol modification, administered by physician or other qualified healthcare professional, face-to-face with multiple patients, each 15 minutes. The physician or other qualified healthcare provider conducts a face-to-face group session to assist patients in improving social skills through practice, corrective feedback, and homework assignments, honing in on individual social or behavioral issues. The provider oversees individual needs and makes appropriate adjustments for the group as necessary in real time. This code is reported for groups consisting of no more than 8 patients. Behavior identification assessment, administered by a physician or other qualified healthcare professional, each 15 minutes of the physician's or other qualified healthcare professional's time face-to-face with patient and/or guardian, /caregiver, administering assessments and discussing findings and recommendations, and non-face-to-face analyzing past data, scoring/interpreting the assessment, and preparing the report/treatment plan. The physician or other qualified healthcare professional spends face-to-face time assessing the patient to identify any impaired social skills, communication deficits, destructive behaviors, and any additional functional limitations resulting from noted maladaptive behaviors. This service includes obtaining a detailed history relative to the patient's behavior, observation of behaviors, administration of standardized and non-standardized testing, focused interviews with the primary guardian or caregiver, and non-face-to-face time reviewing and analyzing the information. Scoring/interpreting test results, and the creating a treatment plan and report. The treatment plan may include recommendations for further observational or exposure behavioral follow-up assessments and discussions, including recommendations, with the primary guardian or caregiver. Behavior identification supporting assessment, administered by one technician under the direction of a physician or other qualified healthcare professional, face-to-face with the patient, each 15 minutes. A single technician administers a behavior identification supporting assessment of a patient with deficient adaptive and maladaptive behaviors or recurring actions or issues related to these behaviors such as communication or social interactions. The technician spends face-to-face time with the patient conducting the assessment, which includes exposure of the patient to a number of social and environmental elements associated with the maladaptive behaviors. Evaluation targeting certain adaptive and maladaptive behaviors includes assessing triggers, events, cues, responses, and consequences associated with the deficient behavior. This code describes assessing and analyzing functional behavior and includes other structured observations, the use of standardized and non-standardized instruments, and procedures that will assist the clinician in establishing the degree of adaptive and maladaptive behaviors or impairments of the patient. This service is performed under the direction of a physician or other qualified healthcare professional but who is not required to be physically on site. Debridement, e.g., high-pressure water jet with/without suction, sharp selective debridement with scissors, scalpel, and forceps, open wound, e.g., fibrin, devitalized epidermis and/or dermis, exudate, debris, biofilm, including topical application, wound assessment, use of a whirlpool, when performed and instruction, for ongoing care, per session, total wound, surface area, first 20 sqcm or less. Each additional 20 sqcm, or part thereof. A healthcare provider performs wound care management by using selective debridement techniques to remove devitalized or necrotic tissue from an open wound. Selective techniques are those in which the provider has complete control over which tissue is removed and which is left behind, and include high-pressure water jet with or without suction and sharp debridement using scissors, a scalpel, or forceps. Wound assessment, topical applications, instructions regarding ongoing care of the wound, and the possible use of a whirlpool for treatment are included in these codes. Removal of devitalized tissue from wound, non-selective debridement, without anesthesia, e.g., wet to moist dressings, enzymatic, abrasion, larval therapy, including topical application, wound assessment and instruction, for ongoing care, per session. A healthcare provider performs wound care management to promote healing using non-selective debridement techniques to remove devitalized tissue. Non-selective debridement techniques are those in which necrotic and healthy tissue are removed. Non-selective techniques, sometimes referred to as mechanical debridement, include wet to moist dressings, enzymatic chemicals, autolytic debridement, abrasion, and larval therapy. Wet to moist debridement involves allowing a dressing to proceed from wet to moist and manually removing the dressing, which removes the necrotic and healthy tissue. Chemical enzymes are fast-acting products that produce slough of necrotic tissue. Autolytic debridement is accomplished using occlusive or semi-occlusive dressings that keep wound fluid in contact with the necrotic tissue. Types of dressing applications used in autolytic debridement include hydrocolloids, hydrogels, and transparent films. Abrasion involves scraping the wound surface with a tongue blade or similar blunt instrument. Larval treatment may include larvae placement on the wound, which in turn feed off the dead tissue, and or application of the larvae digestive excretions, allowing for debridement of dead tissue with no damage to viable tissue.